So let me get a couple of quick things out of the way. First of all, thank you to Aman for inviting me along tonight. This is my first time at a Scalpels and Spreadsheet event. As somebody said beforehand, you've never been to one of these and you're the first speaker. Good luck. So get a couple things out of the way right away. I'm an actuary by background, and I've spent my life as a consultant. So everybody wants to leave now for either of those reasons. Okay. So all joking aside, what I take from that is, as an actuary, I'm a numbers guy who knows the insurance business. As a consultant, I've been working with companies for close to 30 years now to make good decisions in some element of healthcare. First part of my career was working with large employers on everything from wellness to health insurance, disability, whatever it might be, but helping those companies to figure out how to best provide health care and health supports for their employees and their plan members. In more recent years, I've been working with a lot of health tech and startup companies to help them figure out how to understand this whole group insurance business that I spent the first part of my career in. It's not easy to figure out who your buyer is, how to go to market when you're doing something that no one's ever done before. So I have been trying to leverage the work I did in the first part of my career with what I'm doing now. It's all about helping people have the right information to make good decisions. And yes, I used to be that young. So one of the things that I've noticed, having gone to a lot of tech events over the years, is a lot of the conversations you see tend to be focused on things that are consumer. They are things, and it's outside the healthcare space, you get this where the user is the one who decides to make the purchase and the one who pays for it and the one who uses the product. It means you need one value proposition. You have one person. In healthcare, you often have three. And it's important to remember that these three different parties come at it from different perspectives, and you need to talk to them differently. Sure, there's overlap sometime, but just take the prescribers. If you are developing a new medical device that someone's going to use in their home outside the hospital setting, does the doctor know about it? Does the store that's actually selling them actually have them in stock? That's your supplier, your prescriber. The individual who is going to use the device, it's a patient presumably, but in some cases, depending on what you're doing in healthcare, it's actually used by a healthcare practitioner. Very different from the person who may be just making the decision, even in a hospital setting. It may be an administrator who's buying the devices for the physician to then use. Those are two different audiences. And then the one that is near and dear to my heart because it's such a pain for most people. Who is going to pay for it? In the Canadian healthcare system, we have some fairly unique lines between public and private health, different from how it works in the rest of the world. Aman was making reference. I've done some work with European companies coming into Canada. There's that perception of we have a public healthcare system. Well, we do, but we also have a private healthcare system. And our private healthcare system sits beside the public system in a fairly unique way compared to the rest of the world. So what you end up with is this weird situation where a lot of the developments in health technology these days are taking things out of the hospital and moving them into people's homes and for the patient to take care of themselves. What that means is sometimes you're going from something that used to be paid for in the hospital, and now for convenience and because the technology exists, it can be done outside the hospital, but it may fall out of the public budget. So you have these odd elements where how it's done today and how a new innovation will be done from a payer perspective may change. Becomes very challenging to then figure out how do you speak to all three of these audiences when you've got something that's never been done before, and it may be done in the future differently than the current system is done. So creates some interesting conversations, but again, thinking of it as you need value propositions that address each one of these three, not just one of them. The second piece I want to talk about is thinking about who your customer is. And I'm using the customer in a very broad sense here, but who's going to pay for your service? Focusing on the payer side of it. Was doing some work recently with a company that has a fairly unique rehabilitation program geared towards cancer patients. they're trying to figure out, well, who is interested in this? Should we be talking to public health? Should we be talking to insurance companies? Should we be talking to people who are already on disability for, because of their cancer? Should they be talking to, and the list goes on and on. So what I found in these situations is what ends up being kind of the priority as you're trying to figure out how to not waste your time talking to the wrong people, how to find the right people to talk to. Oftentimes, you don't know all the niches that exist in the healthcare system. Especially when you're talking from a payer perspective. There's all kinds of interesting niches in the health and benefits insurance space that not everybody knows about. You're not supposed to. That's not your business. But you need to somehow find a way to look at the entire range of what's out there. And I often work with companies doing some of these things. It's the third point here that I think is the most important one. Once you've looked at all the possibilities, you need to break them into categories. There's ones that you want to proactively go after. This is where we think we can make money. This is where we think we can launch and land and grow our business. There's a second group, which is they're adjacent. They're not going to distract us from our business, but they're maybe not our priority. They're not going to make us the most money. They're not the long-term goal. The third group, the ignore, is just as important, because if someone comes to you and says, "Can you do this for us?" say no. Consciously make the decision of the things you're not going to chase because they're not part of where you want to be as a business. In early days, when you've got 10 interesting conversations you might be able to have, knowing which ones not to have is just as important as knowing which ones to prioritize. Once you've got that broader who are we talking to and what are we talking about, then you can get into the more tactical side. You go, what sector, who are the companies, who are the people, who are the divisions and business units within those companies? I've had a number of very interesting conversations with people who have been at different stages in the process of, we've got a great meeting, we've got a meeting coming up with Sun Life, or we just had a great meeting with Sun Life. I'm not picking on Sun Life for any reason, just pulling their name out. Asking a few questions, you find out, well, this is what we do, and this is who we met with. Those two things are completely on opposite sides of the company. You met with someone who has nothing to do with your business and probably doesn't know the person who you should be talking to. So just because you've got the company doesn't mean you've got the right person to talk to. Again, understanding your audience, knowing your audience, finding the right person. Extra time to find the right person is probably more important than the time you actually spend speaking to them. So lastly, I'm just going to go through, call these, things I've learned from having these conversations, some of which go well and some of which don't go well, in trying to help people figure out that best path to growing their business. I'm going to, harp on this one again. You need to talk to the right people. You need to understand why you're talking to them. You understand what they're looking for, and you need to do it in their language. You're not talking about you, you're talking about them. This is I actually sat down with it. It was an executive from a pharmaceutical company who, at the end of what turned into almost an argument as to why the people he wanted to talk to I was telling him they were not going to see his point of view, and they didn't care about that because that's his problem and not their problem. They're looking to solve their problems. They don't care what your problem is, don't care what your solution is if it doesn't fit one of their problems. Now, not only does it have to fit one of their problems, oftentimes you get this, well, they understand the problem and they know they have it in their business. Great, that's an opportunity. Maybe. Is it a priority? Do they feel any pain from that problem today? Are they actually driven to solve it? These are the kinds of things you need to do to weed out. That was a good conversation. He understands what I'm doing, but is he actually going to buy it? And this is the piece about, you need to work with them. Just because they have a problem and you have a solution that may address it, doesn't necessarily mean it's a good fit. It may not fit into the way their business works. If they have to rearrange how their business functions or the steps in the process because you're going to put something new at one point in the process, that's difficult. If you know what you're replacing in their current system and it's plug and play, that's far easier than to say, well, if you redo your process, we can do this better for you. They can see that big picture, but it's not going to happen quickly. And this is working with international companies, I've really kind of learned that Canadians have some fairly unique mannerisms, if you will, when we do business. Just because somebody loves it, that's different than them saying, we're going to buy it. I had this conversation with somebody who was actually here from Greece shortly before the pandemic. Had probably 8 or 9 meetings with different companies that they were hoping to do business with. At the end of that, we do a bit of a debrief. Those went great. I'm like, what you got is the Canadian no several times, which is, that's very interesting, let's keep talking, we can meet again in 6 weeks and I'll bring people from my team. That means they're interested. I'm not sure that means they're going to buy. Important to figure out the difference, which kind of leads me to my last point. Canadians may not say those things bluntly. You're rarely going to have somebody say, that's a dumb idea, I don't want to talk to you again. However, if you ask the right questions, they're going to give you the honest answer. Do you see buying this in the next 6 months? Do you have a budget to replace what you're doing now for this in the next year? What's the time frame you think you would be looking at this in more detail? You will get honest answers. If you don't ask the specific question, though, you're going to get answers that sound more like pleasantries that you could misconstrue or make assumptions that may not be appropriate. So the last point, if you want clear answers when you're talking to somebody about where you're going to go with their business, you need to ask the clear questions. Now, I saw Aman up here look like he was about to pull the hook here a moment ago. But again, healthcare is unique. The Canadian healthcare system is also unique compared to other healthcare systems around the world. It does make for some different ways you have to approach the market here, even compared to what you do in other markets. Now, that's not to say that the U.S. market may be sort of the big pot of gold at the end of the rainbow. However, there are things you can learn from the Canadian market, even if you are going to the U.S. market. There are things that are unique demands in the Canadian market that you can meet here, even if you're never going to be in the U.S. market. So, a few just thoughts and things I've learned along the way. Aman, I probably have a couple minutes for questions.
We give a round of
There used to be a time when there were clocks in the room. I knew how long I was going, but yeah.
Thanks, Tim. Given the top 11 you had there, what are some of the biggest pitfalls you might see from an early or mid-stage startup founder who's looking to make that next jump?
So great question. And some of them, there's probably a couple that go together. And part of that is using your time well. If there's 50 people you can have good conversations with to find the 3 that might be interested in doing business with you, it would be much better if you could do the pre-thinking to avoid 45 of those meetings. You're still going to meet with 5 or 6 people to find the 3 that want to do business with you. You're not going to get it perfect. But the time spent thinking about who you're going to meet with rather than the time spent meeting with them. And I'll say that with a bit of a caveat. It depends on what you're looking to get out of the meeting. If you're purely looking to learn because you want to talk to lots of people and get feedback, that may be different. You may want to talk to volume then. But if you're looking to have conversations with, we need a customer, we need revenue, we need a partner, you're better off to be narrow and focused and think about it well. So I would say making good use of your time when you go to market, because it's very easy to have too many good conversations. I see nodding, so I unfortunately have people that might know what I'm talking about. Yeah.
Any other questions?
Hi, Tim. This was really helpful. Thank you so much. I wanted to ask about like the conversation sort of ideas that you put right at the end, how that relates to the 3 personas that you mentioned earlier. Because in my experience, the problem as it pertains to the patient, or whether or not they're using it, or it's for them, or whatever it is, and the payer is different from the customer. Yeah. And the story might be very different. The narrative might be very different. So how do you make sure that you're not like redefining the problem and redefining the solution too much, where there's like a mismatch, while making sure that it's targeted?
Yeah, and great question. I mean, if the fact that you may need to look at it from different angles, those better be consistent. But you can look at it from the left side, the right side, the top, the bottom. You're still looking at the same solution, but you just need to frame the advantages and the value differently. A lot of the time, the conversations need to start with, well, the successful business conversations need to start with the person who's got the money, the person who's paying for it. Presumably, before you get there, you know that there will be value to the patients, there will be value to the members who are using it. That's oftentimes the kind of initial stage. It might be the reason your business started in the first place, because you know that people need this solution. From a getting business perspective, you tend to go from the who's going to pay for it, and yes, they'll pay for it, and then kind of work your way down.
Any other questions? Great. Well,
Thanks very much, Aman. Thank you.